at this point, his doctor is like, hello, welcome back to my channel. My name is Tanasia. For those of you that don't know, I am an almost single mom of 4, and 2 of my children have disabilities, and I am here to give you guys the unspoken truths of having 2 children with disabilities. This video is actually going to be about my 16-year-old son being diagnosed with stage 3 chronic kidney disease. He actually wasn't just diagnosed at 16. He was diagnosed with kidney disease at 3 days old. So let me give you guys the backstory. We're going to go back. We're going to take it back. We're going to take it way back. So let's go back to mid-December 2009. I was almost 8 months pregnant. I was about 8 months pregnant, maybe a little more, a little less, with my son. And I had a scare. I thought my water broke. I sat on the toilet to go pee pee, and for like almost 10 minutes straight, I could not stop. It was just coming. Every time I thought it stopped, I would get up to wipe, and it would start back again. And I had my little cousin take me to the hospital. I was like, I think my water broke, but I wasn't sure because with my oldest daughter, my water didn't break. I went into labor with her, and I wasn't sure if I was actually in labor with her either. I just didn't feel right. So I had her dad take me to the hospital. And I got there and they were like, yep, you're having contractions. That's what that weird feeling is that you're having. We're having a baby today. And they actually broke my water. So I had never experienced my water breaking on its own. But it felt like how people described it in the movies of having their water break. So my cousin drove me an hour away to the hospital. We got there. They did a test of my vaginal fluids and everything. They were like, you know what? We don't think your water broke. But we're going to go ahead and let you schedule an appointment to see your OBGYN within a week. So they scheduled that. I don't think it was really far out, maybe 5 days or so. And so come December 22nd, the day of my doctor's appointment, my appointment I remember was at 9 a.m. So I let my job know that I had a doctor's appointment. I'll be into work just after my appointment. So I drove myself to my doctor's appointment, and I got there. They did my ultrasound and everything, my urinalysis, everything looked good. But the ultrasound tech was like being weird. It was taking a little bit longer than typical, and her face was just like she was trying to figure something out. And I was just like, "What's going on?" She was like, "The doctor will be in here shortly to explain everything to you." So I just got nervous, like, "What is going on here?" And so the doctor came in and explained to me. She said, Miss Thomas, we are going to be having a baby today. And I was like, wait, what? This I'm thinking. It's December 22nd. My due date was originally, I believe, February 5th or February 4th. And then she changed it to January 28th. And here it is, December 22nd. You talking about we about to have a baby. I am not prepared. I was not expecting that. I am in my work clothes. I didn't have anyone bring me here. I drove myself because I thought it was a doctor's appointment. I'm going to be going to work. Um, but yeah, she's like, no, absolutely not. She was like, there is absolutely no fluid around this baby. She said, I almost have never seen this. I've studied this in school while I was in med school, and I know that this is dangerous. I don't know how you nor the baby or are still walking. Like, you don't feel sick, you don't have any fever, no type of infection, and that is common. When people have no fluid around their baby, infection is usually immediately after. And granted, now it's been 5 days since I had the episode where I thought my water broke or I was leaking fluids. So 5 days of no fluid, my baby was in there. And so yeah, she's like, first, we're going to go ahead and try to replenish some of those fluids before we do anything. So they checked me into labor and delivery. I was so nervous, y'all. And his dad was in New York at the time, so I was alone. And I get there to give me 3 bags of fluids to see if I was able to keep them in utero. None of the fluids stayed. It was not helping. It was not doing a thing. Um, So it's like, you know what? Yep, we got to get this baby out of here. We don't want to push a C-section, but if it has to come to that, we will. So I was like, absolutely not. I do not want to be cut. Let's try everything else first. So she went ahead and started me on Pitocin to get things going. Whew, that was my only Pitocin. No, 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 no. I had two, both of my boys were Pitocin labors, but this labor, you guys, was terrible. I was in labor for about 13 hours. Oh my gosh, the worst contractions of my life. I don't know how I even proceeded to have children after him because that was terrible. My first daughter, so easy. I think I was in labor for maybe 5, 6 hours, and she was out of here. I'm talking about before the epidural could kick in. We're pushing with her. But with Caleb, oh my gosh, y'all, all day. I had watched all my favorite shows. I done watched Bad Girls Club when Natalie Nunn and I think Portia or whatever her name was scrapping. I was in that. That was keeping me distracted from the pain. Then my favorite movie, Coming to America, came on. You guys, I was. This is where it was time to push. It was terrible, but my movie was on, and I was in labor pushing and quoting this movie line for line, and the nurses could not stop laughing. Like, what the world? But anywho, I did it by myself. My family did. Once I called everybody, told them what was going on. They did come up. They brought my daughter so she could see me and see what was going on. But it was so painful that everything got so overwhelming that I was just like, y'all got to go. I appreciate y'all driving over an hour to come and check on me, but I really think I need to do this by myself. I need to lock in. That wasn't a term back then, but I was like, I need to focus. I really need to get in my zone right now. And that's what I did. I kicked everybody out. You gotta go. You gotta go. She's touching stuff she ain't supposed to be touching. I am. Ugh. So, yeah, I did my labor. He came out. I think my son was just under 5 pounds. I'm not sure. I can never really remember his weight because it was all over the place. Um, but I remember when he was born, he didn't look premature at all. He didn't look early at all. He was big like the Hulk. He was muscular, and so I was like, what the heck? What kind of baby did I just have? Come to find out, you guys, all of that was fluid. He had been drinking the little bit of fluid that they had been putting back in me because he was so dehydrated, and he had a blockage, so he couldn't pee it back out. So all of that was swelling. The hospital I gave birth to him at did not have a NICU, so within a few hours of him being born, they had to transport him to a hospital that did have a NICU. And I was just like, y'all taking my baby where? And I'm supposed to stay here while he's over? And absolutely not. Go ahead, discharge me. Let me go see my baby. And so, yeah, they pretty much let me go first thing the next morning. I had no complications after. I went to the other hospital immediately from leaving this hospital to go and see him. And y'all, I had the most beautiful baby boy. I looked at this baby like heaven. Jesus, thank you. This boy is beautiful. The most beautiful. He was born with like gray blue eyes. He looked Caucasian. I don't know where the genetics came from. It wasn't mine, but he was beautiful. I had the most beautiful little tiny baby. He was so small at this point. Now, the next day, like I said, he was just about 5 pounds, I believe, when he was born. But the next day, his weight dropped to about 4 pounds, just under, like, just above 4 pounds. And I noticed that they were measuring, like weighing his diapers, which I believe is common in the NICU. He was taking breast milk fine, just fine. I was pumping and doing the things. And then the second day came, which was Christmas Eve, because yeah, December 23rd, they sent him to the other hospital. Christmas Eve, December 24th, I came to see him, and I was in the pumping room pumping my breast milk so I could feed my baby. And I got a knock on the pump room door, and they was like, Miss Thomas, and I'm like, this, yeah. They's like, whenever you get time, we need to see you. Something is going on, and we need to inform you what's going on. Y'all, I got so nervous. I done spilled the breast milk. All the freaking golden breast milk that I just pumped, I spilled it. I was nervous. What could they possibly be telling me about my baby now? everything was fine. This entire pregnancy, everything was good. And here we are, Christmas Eve. So as soon as I clean everything up and come out of the pump room and go into the NICU, um, come in. Okay. So as soon as I go into the NICU, the doctors is waiting by my son's bedside, and they're basically like, we have been weighing his diapers since he's come here, and he has not been wetting diapers today. No wet diapers today at all. I'm like, wait, is that normal? This is I don't know anything about boys. I had a girl first. We don't have many boys in our family, so I'm like, is this normal? Is that they're like, no, it's not normal at all. Um, and so they're like, we suspect something else is going on, especially with, how you had to deliver him and what came about him having no fluids. We just don't want to take any risk. So we do have a helicopter en route coming to get him, to fly him to Charleston, South Carolina, to take him to a a better hospital. MUSC is a medical university, so they have a lot more everything. Everything. This hospital had everything. So, like I said, the helicopter came, got him. I called my sister, I called my entire family. I am bawling my eyes. I'm crying. Y'all don't know what happened. They had to fly him to Charleston. That's over 2 hours away. I don't know. I don't know what's going on. I just need to get to him. And so, my sister came. She's my savior. She's my baby daddy. She was there. I'm talking about no questions asked. And she had her own family, her own fiance, her own daughter. She dropped everything to be there with me. I believe my uncle or my grandma, one of them drove us up to Charleston to go see him initially. My grandma prayed. Of course, I had a praying grandmother. She prayed prayers that you would feel in your bones. It would give you chills. The hairs would stand up on your body from this woman's prayer. She prayed a prayer that made me feel like everything was going to be a-okay. And yeah, so we get to the hospital and I met my pal, my buddy. We're still great friends. My son still follows him to this day. Dr. Purvis was his urologist. He met us there and he's like, Miss Thomas, how'd you get so lucky? And I'm like, lucky? I am frantic. I don't know what is going on here. And he's like, no, like, this is the second case this week that I've seen in newborn boys where we have a condition called PUV, posterior urethral valves. So what that is, he explained to me, is when basically urethral valves did not fully form, so it didn't fully open, and it's a blockage. Like some urine is able to leak out, but with force, like if you try to pee, like you feel the urge to pee and you try to pee, it's just gonna close. The flap is gonna close. Nothing's gonna come out. So he was like, we're gonna need to operate on him, and we're going to need to do this ASAP. So Christmas Day, he had his first surgery, and they went in and opened up that valve, and he was catheterized for a minute. That seemed to have taken care of things, but with PUV comes kidney reflux disease. What that is when basically when the urine can't come out, it start backing back up into from the ureter or urethra. I get them confused. One is at the bottom and one is at the top, but it goes from the tube into the bladder, back into another tube, and then up to the kidney. So that's what his pee was doing. It was backing back up into the kidney. And so we had to get that hole back open and get the catheters going. He came home on a catheter for a while. Even after I was able to remove it, I still had to do intermittent catheters throughout the day to make sure all the urine was out. We could not risk any bladder infection, any kidney infections, any UTIs, which he has been plagued with this stuff his entire life now. So that went on. And then my son, at 6 months old, he was such a tiny baby. He was, they called it failure to thrive. That's when the baby don't gain weight like it's supposed to. My son was 6 months old, still wearing newborn clothes. He was 6 months old, weighing about 6, 7 pounds. He was tiny. This was my little Tweety bird. His head was the biggest thing on his body. Um, so at 6 months, about 6 months old, I am holding my baby, and I'm noticing like he just looked so drained. He had been crying, crying, crying. And his grandmother was like, he probably has colic. Put a little peppermint in his water. He'll be fine. Feed him a little bit of water, not much, because he still needs to get his nutrients so he can get big. So I'm doing that for about a day or so. And I'm noticing that he's getting burnt out. He's getting lethargic on me. Talking about, I was holding him in my arm and he was just giving me the blankest stare. At this time, his dad had come down from New York to be there with us, and I told him everything that was going on with him. So he got there and he was there. And I told him, like, CJ, listen, something is not right. He went from crying, crying, crying to only time he is okay is if I'm holding him, but he's not blinking. He's just staring. And I was like, I can't, every time I move him, he'll start crying. So I can't even sleep. I'm having to sit up with this baby in my arms. He's uncomfortable somewhere and I can't figure it out. His stomach isn't hard. He doesn't have to pee. I mean, he doesn't have to boo boo. It's no constipation. I just don't know what's going on with this baby. I take him to his pediatrician. They immediately do a urinalysis and it's like, and do labs. They drew blood and they were like, get this baby to the emergency room right now. Right now. When they did the urinalysis, they went in and did another catheterization. So they put the catheter in to get all the fluid. They was like, this baby has a severe UTI. When they put that catheter in, you guys, it was disgusting. There was so much white debris. Do you understand how tissue looks if you take a sheet of tissue and put it in water, that how it breaks, and that was coming out of my son. Whew. Mind you, he had already been on antibiotics daily since he was born to prevent this from happening. Well, it happened again. So now I'm like, what the freak? What is going on? I know I've been giving him his meds how I'm supposed to. I've been doing these intermittent catheters how I'm supposed to. I've already gone back to work at this point, and I was I was traumatized. I was in a bent up shape, baby. I could not stop crying. I don't know what to do. Grandma prayed for us again. And I felt like everything was gonna be okay. Granted, we're back where we live in Florence, and they're like, no, we gotta send him back to Charleston because they know what to do over there. Send him back. Y'all, why the PUV came back? Clearly when they went in the first time, they didn't get all of it. They didn't open the tube all the way. So there was still a blockage. So instead of it being like this, it was like this. And by him having to get catheters every day and an infection being present, now it's swollen in there. So it's almost like no opening. Oh my God, poor kid. But so he had to have surgery again to get that tube open back up. At this point, his doctor is like, Tanasia, look, this infection was so bad that the urine was definitely backing up to his kidneys and he is in kidney failure. They started giving us all this paperwork about transplant list, dialysis, all kind of stuff. Then I lost it. I lost my marbles. I am bawling hysterically. What are we doing here? God, what are you taking me through? Is this some type of payback? Is this some type of, what did I do? I did something wrong. I did something wrong. I blame myself forever. And the doctor was like, no, this is common. This is what happens in kids that suffer PUV. And another thing that we want to keep an eye on is valve bladder. That's when, okay, typically if you have to pee, when your bladder get full, you feel it. You know you have to go use the bathroom. You're rushing to the bathroom. Kids with PUV get something called bowel bladder wear. The bladder would just grow, grow, grow. It grow, it grow. It can hold so much urine. They would not feel the urge to use the bathroom. So you have to tell them it's time to go or do the catheters like we were having to do. So we did the surgery, opened that thing back up, and they started us on some vigorous antibiotics via IV to try to kill the bacteria, the infection, get everything under control. That helped. That got one of his kidneys back up and running at about 45%, which was good enough for him to not have to do dialysis or consider a transplant at the time. But unfortunately, I want to say his right kidney, we lost it. So at 9 months old, we had to go in and remove his right kidney. And we did a procedure called a ureterostomy on his left side to protect his left kidney, since that was the only one that was good. We didn't want any scar tissue. We didn't want any UTIs. We didn't want anything messing up that kidney because it was like gold at the time. So, geez, my boy had this ureterostomy for the first 2 years of his life. He could not pee out of his junk. Um, the pee would leak straight from the tube. It was a hole like in his side here. And what I would have to do was double diapers. He was small, but I would buy the largest size diapers at the time. For him, I think I was doing a size 4 and a size 5 in diapers, and we were double diapering and just letting it catch everything because they didn't want to put the ostomy bag on it because of bacteria, and they didn't want to risk anything. So he's like, nope, leave it open, let it drain like it's supposed to. As soon as fluid hits it, it's going to drain right out. So we did that for the first 2 years. Then, Jesus, guys, we had a break. After 2 years, we did the surgery to reverse the ureterostomy. His kidney function on the left side looked amazing. The refluxing looked like it had subsided. There was no refluxing going on at the time. Well, no, I'm lying. There was just a little bit, but not much to be concerned about. What I had to do was make sure that he was using the bathroom every 2 hours. So that's when we were able to start potty training him when he was about um, almost 3 years old. So we started potty training him. We were using the bathroom every 2 hours and we were double voiding. That's when you go pee pee. And then when you're done, you wait about 30 seconds and you go again. And every time, y'all, this boy, I said, you can hold some urine in that little body. It would be so much. But it definitely helped us preserve his kidney. What else did we do? What else did we do? All right, so a while. We went a while with no incidents. And then boom, soon as he turns like 6, 7 years old, he's back in school. Here go the UTIs because now he's at school playing. He's not remembering to use the bathroom. And he doesn't want to be different from the other kids. So he's not about to go to the bathroom. Anybody else using the bathroom every couple hours? So y'all, this is when my son started really, really, really having um mental health type ordeals. We were experiencing ODD, which is oppositional defiance disorder, signs of ADHD and ADD. And I was doing my research and I'm like, listen, I feel like this is stemming from this kidney. This kidney disease is, and other life issues and stuff that was going on. So I was able to get him into therapy. We started therapy and behavioral therapy back then, or anger management, as he would call it. And let's see, y'all. Then a few years later, we moved to North Carolina because this kid, he was so dramatic about everything. And I was just, one day, he was just like, Mom, I don't feel good. I feel so sick. I'm going to pass out. I'm like, boy, you're not going to pass out. You are fine. Then I touched him. I'm like, you do have a little bit of fever. So I gave him Tylenol. Then I looked in the back seat and I just saw him laying over, like, the look in his eyes. I was like, something's not right. I touched him And immediately he was burning up. I said, I gotta take this kid to the emergency room. Mind you, this is the weirdest time for me. It's just before Christmas again, right before his birthday. And was it? No, sorry. This was after his birthday. This was because the baby got sick on his birthday and had to go into the hospital with heart and lung failure. And as soon as she got out, the same, like within 2 days, he got sick. So it's January around her birthday at this point. And I took him to the emergency room, y'all, while we were hit with another terrible UTI. Another freaking UTI. His temperature had gotten so high. Mind you, I gave him Tylenol that was supposed to break the fever down. It did not. His temperature kept climbing. So we knew something was off. His temperature reached almost 104 degrees. At this point, he's hallucinating. My son is telling me that there's little people running around the hospital room. He's like, get them away from me. Get them away from me. And he's looking me dead in my eyes. He's like, I want my mom. I'm like, Caleb, I am your mom. He's like, no, you're not. No, you're mom. No, you're not. He's like, can you just call my auntie? She worked at the gas station. He remembered where his auntie worked. And was like, can you tell her to bring me a slushie? And it was just so much. The doctors, the nurses are coming to him, asking him questions like, do you know your name? He remembered his name and asking him so many other things like, well, what do you like to eat? He's like, my mom lets me eat onions and apples. I was like, something is not right. I'm telling them here, like, something is not right here. He's not acting like himself. And they're like, well, his fever is really high. He's delusional at this point. We have to find a way to break this fever. And at that time, his labs had just come back and he was like, yeah, it's a terrible UTI. So they had to transport him from the hospital there up here to Durham, North Carolina, to Duke Hospital. Y'all, why when we get here, his urologist, Dr. Purvis from Charleston, that did his surgeries, was here. He's now the head urologist, pediatric urologist here at Duke. I said, heaven knew to align this thing that way. I said, great. I immediately felt great because at this point, my grandmother, who had been praying over my baby his whole life, is now suffering dementia and her own health issues. She was not able to talk or eat or anything. She was in a nursing home at this point. So I didn't have my baby to pray over me and my baby this time. And so Dr. Purvis was there. He was my angel. And he's like, listen, I got this kid. I know his entire medical history. Let's get things done. Y'all, they told me that my son was going to have some type of ostomy. I don't even remember the name of it because I rebuked it. But it was where they basically make a valve out of his belly button, a flap where he would pee out of. And this was going to be permanent. This is not something that they would be able to reverse like they were able to reverse the ureterostomy. And I was like, yo, this kid is going to freak out if we have to do this to him. And why would you guys do this right now, just before summer? He's not going to be able to enjoy his summer. He loves to swim. We just moved to North Carolina. These neighborhoods have nice pools, nice water. Like this, he's going to school in a new city. I don't want him to feel no type of way. This is my son, my boy, who's going to grow into a big, strong man. And I don't want to do anything to break his spirit. Y'all, I told them no, we're not gonna do it. Absolutely not. I'll wait. Let's see. Let's see how it goes. Can we revisit this thing after the summer's over? And they were like, you know what? Absolutely. We can definitely do that. They were able to kill the bacteria that caused that UTI, give him a bunch of fluids, and put him on a strict regimen. At this point, we were having to use the bathroom every hour and a half and double void. Um, Back on antibiotics again. And what else did we have to do? Another trial drug that they gave us. And I don't remember the name of it. But they was like, let's see if this works. Y'all, kid you not, we went back to the doctor in October. They was like, his refluxing is basically like looking great. I'm glad we didn't do that surgery because it was not necessary. I'm glad that you spoke up and advocated for your son. And that is why I'm here to tell you guys, advocate for your babies. Advocate for your loved ones, for your wife, for your husband, for your sister, your mom, whoever if it does not feel right with you, don't do it. Don't let them do it. They're medical professionals, but at the end of the day, it's your life. It's your person's life. Advocate. He told me no, I told them no. And that's from that day forward. Every time we go to the doctor and they present something to us, I look at him first. I know I'm the parent, but this is his life. And these are things that he's going to have to live with. So I always look at him. I'm like, are you comfortable with doing that? If he tells me no, absolutely not. Or if it's something that I feel like we should do and he's not comfortable doing it, then we'll do our research. And if we do our research and we feel it's best, we'll do it. If not, we're not doing it. Yo, we didn't need that surgery, and I'm so glad we didn't do it. But let's see. But we've been on a great streak from there. His doctor did warn us that, with boys, when puberty time comes, those hormones cause havoc on our vital organs, especially our kidneys and liver. So that we kind of felt some of that. Um, it's really different now for him, especially during flu season. Oh my gosh, you guys, when he gets the flu, it is terrible. We already know we're going to be in the ICU for a few days because the dehydration that comes along with it, the constipation, it's so much that just it caused havoc on his body. So flu season, I try my best. If I don't say what you want to say about me as a parent, not sending him to school, I do not send him to school. If somebody is in his class is sick and their parent sends them to school, mine is not coming. I'm sorry. I'm not going to take that risk with his life. But for the past 2 to 3 years, it has been happening. He's caught the flu and we ended up in ICU. And so right now, this year I would say has been the worst because what people don't realize is your kidneys filter your blood. Your kidneys keep your pH balance throughout your entire body on point. So if your kidneys are not filtering properly, guess what also gets thrown off? The chemical balance in your brain. So now we are coming up on times where we have incidents like when he was little, when we have hallucinations, we have episodes of psychosis and stuff like that. And it always subsides whenever he's no longer sick, whenever his kidneys are back functioning, whenever he gets IV fluids and is drinking plenty of fluids and is using the bathroom and stuff like that. And I just want to tell you guys, you parents, please, for the sake of us all, if your children are sick, please keep them home because there's children like mine who he can't take that. He was homeschooled this year, but as a single working mom, that's I can't do it. That means I'm leaving him home alone to school himself online. It's not going to work. I want my child to be successful just like you want your child to be successful. And if your child is sick, please do take the measures, do what you got to do, talk to your job so you can keep your child home, so you can be home and parent and nurture your child through that sickness. They really don't need to be around other children, or they don't need teachers having to be nurses or moms. They really need to be home with their parent and getting healthy. Um, but that was not to bash y'all, so don't take it that way. But it was just to give you guys a prime example of why it's important to stay home and nurture your children when they're sick. Because you never know what other kids go through. And now, because your child was sick and mine got sick, now my child is out of school for 2, 3 weeks, and now I'm out of work because I have to be a mom and I have to nurture and I have to be there. I have to be in these emergency rooms. I have to sit in the ICU. I have to pray over my child. I have to manage pain with my child. Like regular body aches for him is not just regular body aches. Body aches turn into kidney pain, back pain, bladder pain, joint pain, mental health issues, psychosis. It's so much that goes into it. And this is what I have been dealing with for the past 3 years. And I think I've pretty much exhausted myself talking about this because it is emotional, and I've done such a great job at not crying because I've been talking about it so much lately and advocating for my son, and he has been doing such a great job and giving me the permission to share this with you guys. I've also always been very private with his stuff because he's a boy and he's growing into a man, and I really respect my son's thought process, and I respect the way he feels, and I respect him as a person. And if he doesn't want anybody to know what he's suffering through, I wouldn't want to tell that. And I always felt like it's not my story to tell, but I do have a part in this story because he's mine and I am here with him and I go through these things with him. And yeah, so we are being followed by pediatric nephrology, pediatric urology. He has a psychiatrist, a psychologist. We also am being followed by endocrinologists. Um, what else? We see a cardiologist also, because as we know, everything is all the vital organs. We need to make sure everything is doing what it's supposed to be doing. And we are, let me see, how often are we seeing all of these people? Cardiology, we see every 2 years because he hasn't had any issues with blood pressure until lately when he gets sick. Um, Endocrinologist, we're seeing every 6 months because he has been diagnosed this year with prediabetes, well, last year. And urology and nephrology, we see twice a year. We get ultrasounds and follow ups twice a year. We also get labs quite frequently. And of course, he always sees his regular primary pediatrician and pediatric dentist. But right now, my boy is growing big and strong. We did have to stay in the hospital, like I said, back in January. He was there until February. So I am currently still out of work on FMLA from that stay because paperwork still hasn't been submitted. So I can go back to work. But listen, I don't question God. He does things the way he wants to do things because he sees fit and he knows the purpose and the plan for our lives. And had I been working all those long hours at the dealership, I wouldn't be able to sit here and give you guys these videos. Like I wouldn't have time. That's why I pulled back from YouTube because I just did not have time. But I really enjoy doing this, and it's kind of like a video diary for me, but it also gives you guys insight on what I go through all the time, every day, every month as a mom. But I thank you guys so much for tuning in. If you have made it this far, go ahead and subscribe. Give this video a big, huge thumbs up. Share this video with someone that you might know that might be struggling with some sort of disability, especially kidney disease. All right, that's it. Thank you guys. That's my time.